I'm going to tell you what can go wrong with your gallbladder and how to nurse it back to health. Plus, the pros and cons of keeping your gallbladder in when it is literally being a pain. I'm Dr. Robynne Chutkan, gastroenterologist, microbiome expert, and author, and I am here to help you find gut bliss. The gallbladder is often described as a non-essential organ. But whether you believe in creationism or evolution, there is no question that our digestive system is carefully and thoughtfully designed, and there are no spare parts that you can just remove without consequences, because every single part of your digestive tract serves a purpose. Can you live without your gallbladder? Absolutely. But there is a very good chance that you could end up more symptomatic after removing it than you were before. And I'm going to be explaining why later in this episode. So what does your gallbladder actually do? And if almost 1 million people in the United States have theirs removed every year, how vital an organ can it really be? Your gallbladder is located just under your rib cage on the right side of your abdomen, just below your liver. It's a small sac about the size and shape of a large pear, and its main job is to store and release bile, which is made in the liver. Bile helps with the absorption of fat by emulsifying it. It basically mixes a fat with secretions from the intestines, kind of like how dishwashing liquid helps dissolve grease on plates. Like most of our organs, gallbladder function is based on feedback loops. A high-fat meal causes more bile release, and a low-fat meal causes less. It's a pretty straightforward system, and it works well if you are eating a reasonable diet and avoiding too much saturated fat and cholesterol-laden foods. What's too much? Cottage cheese with a latte for breakfast, turkey and provolone for lunch, and steak, chicken, or pasta for dinner. More on the specifics of what kind of diet you should be eating and avoiding when we come back. The Gut Bliss podcast is brought to you by Visbiome, my first and quite frankly, my only choice for a probiotic. Whether you're dealing with irritable bowel syndrome or just looking to restore your gut health, Visbiome can help. It's a medical food for the dietary management of IBS and gut inflammation. Backed by science and clinically vetted by thousands of my own patients. Find your gut bliss with Visbiome. Go to visbiome.com/gutbliss and use discount code GUTBLISS at checkout. Okay, so let's talk about dietary factors and your gallbladder. Cholesterol is only present in animal products. If you are eating lots of animal products, not just meat, chicken, fish, and seafood, but also dairy, which is actually the #1 contributor of cholesterol in the American diet. If you are eating a lot of those foods, the cholesterol in your diet can crystallize in your bile, causing gallstones. And here's the thing. Most of us do not need to follow complicated guidelines about how many grams of saturated versus unsaturated fat we should be eating. Our bodies give us all the feedback we need. When things start to go wrong with your gallbladder, it is usually a sign that you need to make some dietary changes. The food industry has gone to extraordinary lengths to set up these complex hierarchies of good, better, and best when it comes to cholesterol, with fish at the top of most people's pyramids and red meat at the bottom. I have a friend who prides himself on the fact that he never eats chicken or red meat, but he has fish literally twice a day. He has a very elevated cholesterol, and he claims that there's nothing he can do about it. It's familial, and he recently started taking a cholesterol-lowering drug. The truth is, there is not much difference between beef, chicken, or fish when it comes to cholesterol. Let me give you some numbers. A small serving, about 4 ounces, of beef sirloin has 89 milligrams of cholesterol. A similar serving of white meat, skinless chicken, 85 milligrams of cholesterol. A pork chop, 85 milligrams of cholesterol. And salmon, 63 milligrams of cholesterol. So this idea that one kind of flesh is significantly better for us than another, leaves us scrambling for chicken breast or salmon over hamburger when we really should be thinking about plants versus animals. Simply increasing the amount of plants in your diet, especially green leafy plants, and cutting back on animal products will usually take care of whatever gallbladder issues you are having, and it will also give you a healthy cholesterol level and prevent a bunch of other problems, including things like heart disease and cancer. Now, I'm not saying that diet and a high-fat, high-cholesterol diet is the only reason that you develop problems like gallbladder issues or cancer or heart disease, but it is a huge contributor in most people. And the great news is you do not have to be a vegan or vegetarian. You just have to eat a little more plant food and a little less animal food. The Academy of Nutrition and Dietetics recommends that we consume less than 300 milligrams of cholesterol daily. But the difference between an 85 milligram chicken breast and an 89 milligram piece of sirloin pales in comparison to the fact that fruits, vegetables, nuts, seeds, beans, yams, potato, rice, grains have zero cholesterol. Makes the math a lot simpler. When we come back, I'm going to dive into the 3 main categories of gallbladder problems and what causes them. Gallbladder problems can be divided into 3 big categories. The first is acute gallbladder infection or inflammation, what we call acute cholecystitis. The second group is chronic gallbladder dysfunction, what we sometimes call cholecystopathy. And the third group are gallstones. Gallstones can travel from your gallbladder into your bile ducts that are connected to your gallbladder, and this can cause a blockage that disrupts the flow of bile. When this happens, your gallbladder can become swollen and tender, like a big pus-filled pimple, a condition called cholecystitis. Fever, severe pain, or unstable vital signs raise a concern that your gallbladder may be about to burst open, and surgery to avoid that possibility is usually the best option for severe acute cholecystitis. You do not want your gallbladder to burst. But if a gallstone is blocking your bile duct and you are not that ill, you don't have fever or severe pain and your vital signs are stable, and it doesn't look like the gallbladder is about to rupture, it is then possible and maybe even likely that the gallstone could pass through the bile duct on its own and get eliminated in your stool, and you don't have to necessarily remove the gallbladder. If the gallstone does not pass and is stuck in your bile duct, you could also have a procedure called an ERCP, which stands for endoscopic retrograde cholangiopancreatography. I know it's a mouthful. And that is a procedure that gastroenterologists do. And what we do there is we take a small sort of pipe cleaner-like wire, and we put the scope down through your mouth, esophagus, stomach, and sort of thread this wire up through the small intestine, the duodenum, into the bile ducts, and we sweep it clean. And we ideally are able to remove the gallstone. Sometimes you have to use a balloon and different tools. But that is a less invasive procedure, obviously, than surgery, and it leaves your gallbladder intact. If you are having frequent episodes of gallstones that are causing obstruction of your bile ducts, your doctor may recommend removing your gallbladder. And that is a reasonable thing to do if you are having multiple episodes. But I want you to understand that just because you have an obstructed bile duct does not necessarily mean that you have to have your gallbladder taken out. It is perfectly reasonable, if you are not severely ill, to go ahead with the ERCP procedure, which is generally an outpatient procedure, and leave your gallbladder in place. Now, here's what I really want you to know about gallstones. If I lined 100 random people up against a wall and did an ultrasound on them, between 10 and 15 of those 100 would have gallstones. And of that 10 to 15% of the population with gallstones, the vast majority will have no symptoms whatsoever that are attributable to those gallstones. Now, they may have nonspecific digestive symptoms, as many of us do from time to time, things like bloating, nausea, mild abdominal discomfort. But most people with gallstones have no symptoms that are a direct result of the gallstones themselves, what we call silent gallstones. So again, most gallstones are silent. They are there, but they are not causing problems. If you are one of those people with silent gallstones, your risk of having an acute gallbladder attack is, you ready for this number? Is only 1%. But all too often, these nonspecific digestive symptoms are wrongly attributed to your gallbladder, which is just innocently going about doing its job. It's not posing a threat to anybody. When your gallbladder is removed in that setting, when it is just an innocent bystander, the symptoms that were never caused by the gallbladder in the first place are clearly still going to be there after surgery. And now, in addition to those original symptoms, you're also going to have all the symptoms of not having a gallbladder, which I'm going to be discussing in a minute. But what if your symptoms are caused by your gallbladder and you're having them after every meal? In the absence of a clear need for surgery, like the things I talked about, acute cholecystitis or recurrent episodes of bile duct obstruction from gallstones, or severe symptoms from a poorly functioning gallbladder, in the absence of one of those three indications, I recommend at least trying to hold onto your gallbladder, and here's why. Symptoms like bloating, abdominal discomfort, and nausea may not be resolved by simply taking out your gallbladder, because even when it's functioning poorly and causing symptoms, removing it does not always address the fundamental problem behind why it's not working in the first place. Remember, your gallbladder doesn't make bile. It just stores it for the liver. It is literally a storage organ. If the problem is abnormal bile production, then the factors contributing to that abnormal production need to be addressed. So in addition to too much fat in the diet, other causes of abnormal bile production include overconsumption of carbohydrates, particularly processed carbohydrates, that can lead to imbalanced carbohydrate and lipid metabolism. Another cause is rapid weight loss, including rapid weight loss from drugs like Ozempic. Diabetes is associated with gallstones, alcohol use, birth control pills, hormone replacement therapy, and there's some diseases like sickle cell anemia that can cause gallstones, irrespective of diet or medication, because of pigment stones that develop as a result of the disease. But the point I want to emphasize here is that removing your gallbladder without addressing potential contributing factors is unlikely to solve your problem. And that is demonstrated by the fact that around 20% of people have recurrence of symptoms after their gallbladder is removed. And that is actually a conservative number. I see so many patients in my office who have had their gallbladder removed unnecessarily and are now really struggling with symptoms. And I always say to them, I wish you had come to see me before you had your gallbladder removed. So if you know someone who has gallbladder issues and is thinking about removing their gallbladder, please send them a link to this episode. Let's try and save some gallbladders if we can. So many people find out after surgery that their gallbladder was not actually the cause of their symptoms. Conditions like SIBO, small intestinal bacterial overgrowth, acid reflux, H. pylori infection, stomach ulcers, gluten sensitivity, lactose intolerance, delayed stomach emptying, parasites. There are multiple GI conditions that can mimic the signs and symptoms of a poorly functioning gallbladder, causing nonspecific symptoms like nausea, bloating, and abdominal pain. I can literally give you 50 causes of nausea, bloating, and abdominal pain. By far, the biggest problem I see after somebody has had gallbladder surgery is a continued presence of their original symptoms. And I mentioned 20%, but in some studies, that number is reported in half of all patients who have their gallbladder removed. And obviously, if you have your gallbladder removed unnecessarily, you're likely to be, in that high number of people who have continued presence of the original symptoms. But even worse, in addition to those original symptoms, which were mistakenly attributed to your gallbladder, perhaps, you are likely now to have new symptoms because your main organ responsible for fat absorption is now gone. Without your gallbladder to store and secrete just the right amount of bile after meals, there is now going to be either too much or not enough bile being circulated. Severe bloating and diarrhea after eating is what most people complain of after their gallbladder is removed. But I also see people who report constipation or nausea. When we come back, why is gallbladder surgery so common? Several studies, including one study that looked at 54,000 gallbladder surgeries in Pennsylvania, have found that the number of gallbladders removed in people with minimal or no symptoms more than doubled in the 1990s. Why? Because of the advent of laparoscopic surgery, what we call minimally invasive surgery. Before techniques like laparoscopy, where you just make a few small holes around the belly button and you're able to basically suck the gallbladder out, I'm oversimplifying it, but before we were able to take out gallbladders laparoscopically, removing the gallbladder was a major surgery that involved an extended stay in the hospital and lots of potential complications. Once surgeons were able to remove your gallbladder quickly via laparoscopy and with fewer complications, we saw this explosion in the number of gallbladders being taken out. And clearly, the amount of gallbladder disease didn't just suddenly double. Most of that rise in gallbladder surgery has been in people with what we call soft indications, like a poorly functioning gallbladder or silent gallstones, rather than people with an acutely infected gallbladder or severe dysfunction. But is surgery to prevent an attack before it occurs a good idea? Well-meaning doctors might show you ultrasound pictures of stones in your gallbladder. They might tell you a story of a patient who died from massive infection because a gallstone slipped out of their gallbladder into the bile duct and caused a blockage. But the rock-solid statistic published in our premier medical journal, the New England Journal of Medicine, is that waiting and having emergency surgery, if your bile duct actually becomes blocked, is safer than having elective surgery to prevent a potential blocked duct in the future. So again, I want to be very clear on this. The statistic is that more people die from elective gallbladder surgery than from emergency surgery. And that statistic validates literally the best medical advice I can give you, which is, if it ain't broke, consider not fixing it. Careful observation, which is basically you and your doctor paying close attention to any change in your symptoms, is often a great option. And as that New England Journal of Medicine article illustrated, having surgery now for something that could go wrong in the future but may never happen may not be your best decision. We have seen lots of examples throughout history of tonsils and uteruses and thyroid glands being unnecessarily removed by well-intentioned doctors, but with results that often include a decline in health that cannot be fixed by medication. So our focus should be on figuring out where things went wrong and why, and addressing the underlying problem, which in the case of the gallbladder is often diet. So instead of just taking out the organ and hoping for the best, you should try to hold on to your gallbladder whenever possible. Elective surgery for silent gallstones is rarely necessary, and it is almost never a good idea. If you think your gallbladder is not working quite right, you should definitely get it evaluated. See a doctor, get an ultrasound, and something called a HIDA scan, HIDA. It is a test of gallbladder function. It measures how well your gallbladder is ejecting that bile. And get any other tests or blood work that your doctor recommends. If your problems are more pressing and more serious, you're having fever or severe pain or tenderness, or you have abnormal lab values, and you are told that your gallbladder needs to come out, that is probably the right advice. But if you are one of the millions of people with non-specific symptoms like bloating, feeling full after meals, mild nausea, abdominal discomfort, you need to seriously consider the possibility that your gallbladder itself may not be the culprit, even if you have gallstones, that those may be silent gallstones and the problem may be elsewhere. And even when it seems like your gallbladder is the problem, make sure that it's not an innocent bystander caught up in a web of other issues like too much high-fat food or not enough physical activity. Changing what you eat and how you live is challenging, but it is really worth it when it allows you to hold on to critical digestive organs like your gallbladder. Before you have surgery to remove your gallbladder, I highly recommend asking the surgeon these two questions. Number one, how certain are you that the symptoms I am having are definitely caused by my gallbladder? And number two, is it possible to keep a close eye on my symptoms and make plans to remove my gallbladder down the road if things change or get worse? And I hate to say this, but I have to say it. You may have to push a little bit because this is how a lot of surgeons make a very good living, by taking out gallbladders, even when they don't necessarily need to come out. Had to say it. So I want to leave you with 3 takeaways for gallbladder issues. Number 1, take it bite by bite. Start with adding 1 additional fruit and 1 additional vegetable a week. Not only are these foods cholesterol-free, but some of them can actually help to lower your cholesterol and to lower the likelihood of gallstones because substances called sterols in plants block the absorption of cholesterol in the body. And studies show that people who eat a plant-based diet, again, does not mean vegan or vegetarian, but a lot of plants, those people have much lower risk of gallbladder issues. Number 2, trim the fat. Dairy is quick, convenient, and delicious. It is so easy to grab some cheese and crackers or a Greek yogurt or to order a latte or cappuccino or sprinkle some Parmesan or feta on your salad. But the amount of dairy you're consuming can really start to add up. And dairy is the biggest contributor to fat in the American diet, which is why even vegetarians who eat a lot of dairy often end up with gallbladder problems. Number 3, get moving. A European study published in 2010 showed that people with gallstones who were physically active had fewer symptoms than their sedentary counterparts, and the overall risk reduction for gallbladder problems was as high as 70% in the most active group. Studies also show that exercise can both prevent gallstones from forming and reduce symptoms if you already have them. So that's it for this edition of the Gut Bliss podcast on everything you need to know about what can go wrong with your gallbladder. Go to gutbliss.com for my free 7-day microbiome reboot course. If you like what you're hearing, drop a review and hit that subscribe button. And remember, dirt, sweat, vegetables, the best prescription for a healthy gut.
The information presented in this show is not meant to be medical advice. Consult your doctor before making any decisions about your health. The patients discussed are real people, but names and identifying features have been changed to protect their privacy.